వాళ్ళది కనపడాలి. వాళ్ళు మనకి కనపడాలి. ఇది మ్యామ్ స్క్రీన్ షేర్ చేసినప్పుడు ఆటోమేటిక్గా వాళ్ళ కంట్రోల్లోకి వెళ్ళిపోద్ది కదా మ్యామ్. సౌండ్ ఒక్కటి చూడండి చాలు. అక్క మాట్లాడేది ఆయనకి వినిపించాలి, ఆయన మాట్లాడేది మనకి వినిపించాలి. ఎవరైనా మాట్లాడగలం ఇక్కడ నుంచి అవసరం వినిపిస్తుందో లేదు. లేదా నాకు ఇవ్వండి ఏదైనా ఆన్ చేస్తారా కొంచెం మాట్లాడు.
హలో
సౌండ్ పెట్టు. ఒకటే లైట్ చేస్తావా? ఓ బీకామ్
నార్మల్ జాయిన్ అయిపోతుంది.
నేను మీకు పెట్టాను. ఆ సమ్మర్ నెగిటివ్ ఏంటంటే మనమే కదా.
మనం కాదు అవతల పోస్ట్
నేనే కదా.
టీచర్స్ మళ్ళీ పెడతారు.
ఏం లేదు.
పక్కకి.
ఓ మై గాడ్.
ఈసారి పెట్టండి
రావట్లేదు.
హలో ఆ కెమెరా ఆపు. దాని తర్వాత కూడా ఇంకా లైవ్లో చూడలేదా? నేను మా ఇప్పుడు మీ గ్రూప్ ఉదయం ఒకటే మాట్లాడారు మేడం సార్ జాయిన్ అయ్యారు. ఒక నిమిషం అసలు దాంట్లో ఆన్ చేయలేదు తెలియదు లేదా మన ఫోన్లో
దాంట్లో
వద్దా సరే ప్లీజ్ జాయిన్ అయిపోయింది.
ఇప్పుడు జాయిన్
హలో దాన్ని ఆపండి.
దాంట్లో
ఆన్ అవుతుంది దాంట్లో వస్తుంది
వీడియో కాల్ పెట్టుకున్నట్టు దాంట్లో పెట్టేస్తాను లైవ్ ఆపేసేద్దాం.
మా ఇంకా సైలెంట్ కూడా విత్ ఇన్ 1 minute సెషన్ స్టార్ట్ అయిపోతుంది. ఆన్లైన్ సెషన్, సో ప్లీజ్ బీ సైలెంట్. మా 4th yearలో ఉండేది 3rd year వాళ్ళ గ్రూప్లో కూడా ఫార్వర్డ్ కెమెరా మ్యూట్, మైక్ మ్యూట్ చేయండి. కెమెరా కనిపించినా పర్లా, మైక్ ఆఫ్ చేయండి.
పెట్టే గుర్తు
హలో హలో
ఆయన వినిపిస్తుందా లేదా? ఆయన అన్మ్యూట్ చేసి సార్ అది అక్కడ మైక్ యాక్సెస్ రావాలి. అప్పుడు వాళ్ళు
కాలేజ్కి రావట్లేదు. కాలేజ్కి
చేసి
Is it audible? Hello, Murli sir? Yeah. Good afternoon, sir. On behalf of Narayana Pharmacy College, I welcome you to the one-day national conference on advances in AI-driven drug discovery and development. It's my privilege to read your citation, sir. So, Dr. Murli Krishna Kumar sir is a distinguished professor at the College of Pharmaceutical Sciences, Andhra University, with a prolific career spanning over 2 decades in pharmaceutical chemistry and drug discovery. He earned his PhD from Andhra University in 2006 and it has since made significant contributions to both teaching and research. Sir's expertise lies in pharmaceutical chemistry with a special focus on drug design, marine natural products, and antimicrobial agents. He has been the His work on novel laminarian analogs and biofuels from marine microalgae exemplifies his interdisciplinary research. With over 60 research publications in reputed national and international journals, Sir has made impactful advances in synthetic chemistry, pharmacology, and computer-aided drug design. Notably, Sir has contributed chapters to prestigious books and developed widely used open-source software tools for virtual screening, with over 2,000 global downloads. In addition to his research, Sir has played key administrative roles, including Assistant Principal at Andhra University and Director of the NMR Research Center. Sir has organized and led numerous national workshops fostering skill development in spectroscopy, molecular modeling, and drug design. Sir is dedicated to education, research excellence, and scientific leadership, marks him as an inspiring figure in pharmaceutical sciences. It is my distinct pleasure to invite our resource person, Dr. M. Murli Krishna Kumar Sir, Professor, Department of Pharmaceutical Chemistry, College of Pharmaceutical Sciences, Andhra University, to share his insights with us in the online session. Welcome, sir. Yeah, please, sir. Yes, sir. Yes, sir. Yes, sir. Sir? Yeah, you please share your screen, sir. Yes, sir. Yeah, it's visible, sir.
Let me briefly tell you the way how I made my presentation and the objectives of the presentation and deliverables. I'm basically working on developing new tools, using tools belonging to artificial intelligence category and other categories, so that in the academic environment, in colleges, a faculty or research scholar or B.Pharma student, they can basically they can practice these tools. That is the way how we are trying to develop SOPs, protocols, and small software tools to facilitate propagation of computer-aided drug design and its knowledge among the faculty. So one such effort I am trying to bring before you, like artificial intelligence and its role in drug discovery. And I am going to present before you some of the tools that you are using for effective behavior. I hope all of you will enjoy the presentation. Let us see in brief what what is drug discovery and why it is considered as a target. As of all of you are aware, the journey of drug from desk to pharmacy shop is very lengthy, and it starts with identifying a target, and then we do some basic screening, pharmacological screening to obtain which molecule, and then it will be considered as a lead, and its optimization is done. And after the animal studies, after the human studies, and after all these screening process, we may probably will get a drug molecule out. The different stages of drug. Very common. It is kind of a slide. And where exactly is the knowledge that we also able. If you see in India, out of 100, not even one pharmaceutical company is working on drug discovery. Mostly, the pharma companies are focusing on developing formulations, developing novel formulations, and developing different formulations, and identifying different activities for old drugs and drug discovery, but not focusing on discovering a new drug. Okay, so what was the reason? What are the kind of challenges they are facing that are actually troubling them early? So let us see. If you closely observe in the drug discovery journey, first one is we have to identify the target. Identification of target means, let us say, for the first time we are seeing the disease called as inflammation. One has to study inflammation and its procedure, and study the molecular biology and identify one target protein, which is crucial in happening of inflammation. For that, it may take about 1.5 years. And then they also develop a screening protocol, a model, so that small molecules, extracts, natural products, semi-synthetic products, etc. can be screened. So the preliminary compound screening and high throughput screening may take about 1.5 years. So that in the screening protocols, they will find out some of the bioactive molecules. They can call them as hit molecules or lead molecules. Means they are drug-like, but they are not drugs. Maybe they have pharmacokinetic and pharmacodynamic issues are there. So that is to be optimized. So lead optimization usually takes about 1.5 years for an establishing pharma company. And after that, the optimized lead molecule is appropriate PK/PD profile, pharmacokinetic and pharmacodynamic profile is submitted for preclinical evaluation. And if it is true that maybe hardly 1 year it will take, then phase 1 trial, phase 2 trial, and phase 3 trial, all together, it may take about 6.5 years, even in 2025, for an established drug for
మహా అందులో వాట్సాప్లోకి వెళ్ళి లాగిన్ అవ్వాలి.
If it is a novel alternative for an emergency kind of a situation, like in COVID pandemic, the drugs were improved on experimental basis, on humanitarian basis. At that time, the timelines are different, but normally and approval to launch and approval will take on 1.5 years because market research and all of them are involved.
ఇది మ్యూట్ చేద్దాం.
So this is actually normal.
ఇది
So here everything is clear. Lot of time on time. Success rate, if you closely observe, from target identification to preclinical, huge attrition will be had, huge attrition. Here you can see, you are
సౌండ్
ఇక్కడ పెట్టి ఇప్పుడైతే అవి కూర్చుంది
So now let us see how and where exactly we have an issue, we have the problem, for which we can find a solution. So if you see the four reasons for the 90% of failure in clinical trials, the first one is 40 to 50% lack of efficacy. Lack of efficacy. Maybe you are screening it in vitro, in animal studies, it may be successful. But when you come to the human trials, most of the drugs, they lack efficacy, means estimated required optimal PK/PD profile is not established. And 30% of the drugs are toxic because in the preclinical, in the cellular level or in the animal models, maybe the drug is safe. But once you are testing it in humans, because human biology is a lot more complicated than animals. So quite often you will see toxic side effects. Because US FDA rules were so strict that minor errors, minor side effects also are of concern if it is happening in large population. So that is the reason that toxicity is also an issue. Then 10 to 15% poor drug-like properties. It is also linked to efficacy. And 10% is because of failure in the marketing. That means commercial interest and poor business plan. So here you can see 90% of the issues are linked to drug and its effect on biological system, especially efficacy, toxicity, PK/PD issues. Now, just to give you a brief outline on what exactly happens when a drug is given to a subject, a person, so that from here we can do a retrospective analysis on how a drug can fail. So normally when a drug is developed, most of the drugs are developed by keeping in view safest mode of insertion, like ingestion. That is oral route. Oral route is the safest as far as the availability is concerned. Means when a drug is given in a formulation, tablet or capsule, okay, so then what will happen? Drug has to enter into the stomach, disintegrate, dissolution is to be done, then it has to be absorbed. Once it is absorbed, it will go into blood. In blood, many issues can happen. One of them is protein binding. And after that, it has to cross so many barriers to reach the drug target. And here, drug target, it has to reach the drug target also. It should not go into other tissues. And then what will happen? Some of the drugs that is there in the blood, and when it is circulating, some of them gets metabolized. Some of them gets metabolized. And metabolism also sometimes gives you activity, that is again another issue, or inactive metabolite, and some of them may be toxic. After metabolism, drug is eliminated. So scientists for decades, they have done a lot of research, and now in 2025, where exactly we are? We have databases of information on successful as well as failed drug discovery experiments. So from there, some of the drugs failed in the dissolution, some of the drugs failed in the absorption, some of the drugs created problems because of plasma protein binding, some of the drugs failed because of drug target selectivity, some of the drugs failed because of lack of metabolism or excess metabolism, some of the drugs had issues with elimination, some of the drugs created problems because of formation of active metabolites or toxic metabolites. We have data, a lot of data. So this data helps us in now doing some kind of an analysis so that we can make a knowledge-based decision to help prevent failures to happen. That is where we are in 2020. See, if you see the kind of problem we are facing, if a drug is there, so many issues will be there that actually are creating trouble to us. Okay, so where we have to take a decision based on so many issues. That is where in right now people are looking for tools to do multiple layers of screening protocols. So that's we can say it as a neural network. If you look at our neuron, okay, so if you have cell body and each one of the cells is talking to multiple cells through dendrites, okay, and these are interconnected between different systems. Like if you from your brain, it is connected to skeletal muscles to somewhere else, and all of them are coming and going. The signals are coming and going, and there is a crosstalk also will be there. So this type of decision-making system is helping us make a decision of choosing the right one. Okay? So because in 2020, because of the decades of data that is available to us, all of them can be used as experiences so that a refined knowledge-based decision can be taken even from computational sources. So that is where we have artificial neural networks. Let me tell you briefly about artificial neural network and how it can be compared to or how it can be utilized in pharma sector so that some of the problems can be solved. So the way how the nerve works, here it is taking feedback from many cells in the nearby region and coming to a conclusion so that it is a delivery. In the same way, let us say if you write a program where a processor takes information from various inputs and then it will find some correlation or relation between all these inputs so that efficient output can be given. This is our fundamental output. This is one layer. Let us say if you increase the layers further, means you have inputs that are processed through different layers of decision making so that ultimately result can be obtained. It is more like when you are going outside, okay, when you are walking outside, a dog came to you, barking. On what basis you will respond? So in the decision making of our brain, so many of our old experiences will help us correctly analyze the situation so that an appropriate output can be given. Let us say you are a small kid. What will happen because you don't have any feedback. Earlier experiences are not there. There is no data available in the brain. So straight away the kid may run away or cry or freeze on the spot. So if you are an elder, you are a dog lover, then you have all positive experiences. So when a dog is coming to you barking, you will not feel anything like no tension, nothing, and you will pet the dog. So it is more like on what basis you are making the decision, because in your childhood, when you are growing up, so many experiences were there stored in your brain, processed, so that your decision making is done by letting the input filter through different layers of experiences. So that is the way how, in simple words, neural network works. So let us see our pharmacy problem. Let us say when a drug is to be discovered, okay, what we will do, what we require. A compound is needed for which activity, potency and safety are needed. So for any compound, what are the factors which actually influence all these things? Its physicochemical properties like log value, chirality, molecular value, and molecular substance, and like that, so many things. And then chemistry, like functional groups, aromatic or not, carboxylic acid, nitrocyanide, fluoride, or different functional groups can be there. And what are the other factors which are actually making a drug success or failure? Absorption, distribution, metabolism, related. And then tissue specific, like whether the drug has to go to CNS or liver or kidney or heart, so that effect is coming or side effect is coming. And then its mechanism of action, targets, prodrug, and related issue, and then formulation. So these are all multiple layers of problems that we have. So let us say a compound and its structure if it is known. So what are the dependable variables that we are going to get? Log P value, chirality, pKa, molecular volume are there, which are the properties of the molecule. How this can influence, this is linked to the other. Let us say if we take log P value, for example, all these functional groups or chemistry, chemical structure and structural information is actually crucial in deciding a physical property. And how that is linked to ADME. Having a functional group or not having a functional group is going to severely influence absorption into different compartments, distribution, absorption of a drug across the membranes, distribution into different compartments, metabolism, whether it is metabolized by first pass or second pass metabolism, all those are dependent on chemistry, and elimination, whether it is to be eliminated through lungs or it is to be eliminated through liver processing and then pieces or elimination. Everything is dependent on functional groups only. And then, depending upon the absorption, depending upon the distribution, depending upon the metabolism and elimination, the target area is usually influenced. Let us say, if the drug is having very high log P value, means highly lipophilic, it has certain functional groups, and it is distributed mostly in adipose tissue and CNS. That is the way how one is linked to other one is linked to other, the other one is linked to other. And then in each tissue, what is the mechanism of action it is going to? Is it selective or not? Is it a drug or a prodrug? What kind of formulation we are using? Is it IV route or transdermal or anything else? So in this way, all these are interconnected. And ultimately, when everything goes well, you will have a drug. Compound became drug with activity, potency and safety. So I gave you only a simple format so that each one of this line is like one layer of screening or one layer of thinking. Okay? So when I give you a structure like benzoic acid, and if I ask you anything about it, what type of filters are applied by your brain for giving an answer? Okay, if I ask you what exactly is benzoic acid and talk something about benzoic acid, then you would tell me it is aromatic, it is carboxylic acid, its pKa value would be this much, it will have this type of reactivity. All these outputs are coming because the feed is there at different levels. Okay, so that is the way. So here, this is the challenge that we have. When a drug is discovered, what exactly is happening at different levels, at different stages of drug discovery. A lot of decision making is done based on the result output. Okay, so the output actually is to be made without any prejudices. Because if a human is doing this, to handle huge volumes of data, we have severe limitation, and it takes a lot of time, manpower, etc. Artificial intelligence also because of it. So to summarize, let us say a compound discovery, drug discovery is going on, target validation, compound screening, and then comes lead optimization, then preclinical, so that you go to clinical. So here comes one of the components where we can do something so that attrition rate can be reduced and speed of drug discovery can be increased. That is structure-activity relationship. Structure-activity relationship data helps you make a decision in an appropriate manner. And also in preclinical, after preclinical, here we have structure tissue relation, means how actually structure influences tissue. So if you do these two things, as we have seen in the previous slides, 90% of the problem are because of efficacy, because of toxicity, and because of pharmacokinetic and pharmacokinetic issues like ADM issues. If you do SAR and SDR appropriately, a lot of things can be solved, especially SAR, so structure-activity relationship. Because we can use so many things over here, like in the target validation and compound screening, virtual screening can be done. Virtual screening can be done by using computational tools where artificial intelligence can be used. And after that, obtaining the lead optimization where we apply structure-activity relationship. So for this presentation, for this seminar, I chose structure-activity relationships. And I just would like to show you some of the tools that are available so that you can appreciate the role of artificial intelligence in QSA. So let us see what exactly is the QSA basically. It is more like you have a set of drug molecules are there. Maybe they belong to same class of compounds or different classes of compounds. For these compounds, we already have the biological activity data. Okay, these are more like the data obtained in the target validation, and after that virtual screening or high-throughput screening that is done. So we have all these molecules. So those molecules which have shown promising biological activity, they are chosen, and a relation, they would like to bring out the relation between organic compounds that are showing biological activity and their potency. Here the basic principle behind QSR is any molecule shows biological activity because of its physicochemical properties appropriate. Because a drug, when it enters into the body, it has to travel so many compartments till it reaches the drug receptor site. So it needs to have appropriate physicochemical properties. Then only it will be able to reach the active site. And at the active site also, if a drug has to interact with it needs to have appropriate structure, stereochemistry, and the distribution of functions appropriately on the structure of the brain. So altogether, a compound and its properties are directly influencing the biological activity. So what they will do? They will take the compounds, their structure, their physicochemical properties, and biological activity data. They will try to do statistical correlation so that they will get some kind of a QSAR model in the form of a mathematical equation. So that is actually the QSAR. So it is more like a statistical model we are trying to build so that decision making can be done by using the knowledge we gain from earlier experiences in a scientifically dependable manner. Okay? So let us see the flow sheet normally that happen, that we take in doing QS. First one is as I told you, we actually collect the data, personal data set, including biological activity, structure of the molecules, etc. And then we try to curate the data. Curation means whether the structures are drawn properly or not, stereochemistry is assigned properly or not, IUPAC names are what they are handling, whether they are written properly or not. Like this, we curate the data set and then we try to split the data into three sets, two sets, split into training, test and external validation set. Means if you have 100 compounds, what we will do? We try to split it into a 60, 20, 20. So that with 60 compounds and its data, we try to develop the QSL information. And with the remaining 20, we do internal validation. With the remaining 20, we do the external validation. It is more. There are so many ways how we can design QSL equation development program. This is one of the programs well established. That is what I am trying to present. So here we can have multiple training sets, randomization can be done, so that QSR model can be developed between physicochemical properties and their correlation with biological activity data. And we always try to see whether the model that we have developed has the predictive capability or not. That is very important. And then, when the model is doing well, we will try to validate the models with high internal and external accuracy. Means from our data and the outside data also used for validation. And from there, external validation, if it is done, then we try to obtain the molecules, do virtual screening in the applicability domain, if it is inflammatory or anti-cancer, depending upon the domain. And then we go for experimental validation. Golden standard here is experimental validation. You can predict anything. Okay, all theoretical models need not give you dependable therapeutic outcome. So here, experimental validation is to be done. So this is the way. So in this process, actually a lot of decision making is done based on scientific protocols. So that is the reason why this kind of knowledge-based decision system increases efficiency of the drug discovery process and reduces the attrition of molecules. Means, for example, if you have to synthesize and screen one organic molecule, small molecule for anti-inflammatory, just from in vitro and in vivo in rat model or mice model, it will take for each compound to obtain dependable results. You may have to spend around 25,000 to 30,000 rupees. Okay? So imagine if this screening protocol can increase the efficiency. So instead of synthesizing 1,000 molecules, you can synthesize 15 or 10 molecules. So in that way you can reduce time you are going to spend on synthesizing, procuring, screening, and you can also reduce animal sacrifice and also the time that is needed financially also a lot of advantage because this is a scientifically validated protocol. Okay. So here what is the problem? Why we have to use artificial intelligence here? So let us see. Normally, now this is the protocol, even the audience, if the faculty is there, research scholar is there, informer student or reformer student, for your process you can implement this protocol. Okay? So normally what you would do in case of QSL studies, you want to develop a QSL. So we take the literature, let us say one article or several articles per day, it is better you start with one article containing appropriate chemical data and a biological data. From there, we try to extract the chemical structures and the biological activity data. Chemical structures and biological activity data. Then what we will do? We will try to obtain the physicochemical properties of the compound synthesized and biological activity data in appropriate format by using software tools. And then we use simple Excel or any other mathematical tool to obtain appropriate mathematical statistical correlation. Statistical correlation can be done easily because if one variable, dependent variable and non-dependent variable, two are there. For example, log P value and anti-inflammatory activity. Okay, so if you take ED50 or EC50 value, then one variable is there and one more number is there. So these two are to be correlated. What we can do, correlation coefficient can be done. Let's say if you have more variables and they have to be compared with the biological activity data, then you may have to go for other statistical equations like partial least square analysis or ANOVA or any other software statistical methods that are available, so that you can bring about some kind of a correlation, so that you can have a mathematical equation that is what we call as a PSR model, which further is validated. Once validation is done, right now, because in 2025 a lot more tools are there for cross validation and also parallelly evaluating the outcomes. So once that is all done, once you made a decision, you can optimize the structure which can have more predictive biological activity, so that can be synthesized and screened. That can be synthesized and screened. So this one slide is nothing more than a PhD program. Okay, once. But right now in 2021, because of availability of so many software tools, even a B Pharmacy graduate doing their project work or training in your 4th year, 1st semester and 2nd semester, you also can implement this by using the tools that are available right now. So here, where exactly we have to use artificial intelligence and why do we have to use the artificial intelligence, and is it really problematic? Okay. So for example, first you take the first one, the literature. In the literature, you will get mostly a PDF document. Okay. So here, in the databases, you can have your own database also. Okay. So normally, I don't suggest anybody to use public databases to build QSR equation. That is not at all appropriate, because QSR equation can be developed based on the data of a specific biological activity. So it is appropriate to use a research article. So from here to here means you need to have a software to draw the structures appropriately and then prepare the database. So if you ever tried Chemdra or any other software, for drawing a structure, it may take 1 minute to 2 minutes time for an experienced person. Because you need to be very careful in maintaining stereochemistry, etc. appropriately, so that a database can be made. Let us say 100 compounds are there in the article for which biological activity data are available. Then what we have to do? We have to draw all the 100 structures separately and save them in an appropriate format like .mol format, .mol2, or if it is 3D, .pdb format can be used. Okay. So here we need to be very careful in choosing the right article. Never choose articles that are published in low impact online journals. I don't mean to say open journals are bad, but one needs to be really careful in selecting the article, because whenever we initiate some kind of a theoretical modeling, high quality inputs increases quality of the output. Okay, so that is where we need to be very careful. Then once the structures are drawn, the second problem is we need to obtain the physicochemical properties, and how can we get it? We have so many online tools are available, like ADME, Swiss ADME is one of the popular online tools that can provide you at least a half a dozen physicochemical properties, and many other tools are available. Software, some are paid, some are free. They can be used. So for each of these, you have to give one compound and then obtain the data, and physically you have to copy the data from the web source onto your Excel sheet. It is not automatic. Let us say, for example, you are using Swiss ADM. You have to give the input, wait for the results to come, which is normally very quick, and then copy the data from there. Okay, it takes a lot of time. Imagine for 100 compounds, you have to do it repeatedly. Okay, so you have to give the inputs appropriately to get appropriate outputs. Then next, in the model development, let us say you have chosen 4 physicochemical properties to be correlated with biological activity. So here, what will happen? We don't know which physicochemical property actually is correlated. So what we have to do? We have to do permutations and combinations. Let us say log P value, pKa value, polar surface area. These are the 3 physicochemical properties you have chosen. Then for that biological activity, for example, log P value is direct correlation is there, pKa value direct correlation, and the polar surface area inverse correlation is there. Or there is no correlation at all. Then if you randomly pick up these 3 physicochemical properties and if you submit it for statistical model development, most of the times your model cannot have very good dependability. The validation parameters are going to fail, or you may not be able to build an equation at all. So at that time, we are forced to do permutations and combinations. Like let us say A, B, C are 3 physicochemical properties. First we try with AB, AC, BC, AC, and ABC. Only A, only B, only C, like that. So many permutations and combinations. A student need to spend a lot of time doing the experiment again and again and again. Repetition is happening over there. So in all these cases, let us say if we have some tool, computational tool that can reduce the number of operations, it will help us. Fortunately, we have so many such tools that are available right now. I am going to show you our experience also. I made one example. I hope all of you are okay with this slide. So here, if you see artificial intelligence and their tools, if you take into consideration, so what can be considered as the objectives for AI? So here, especially for yourself, you can see automate the reading of chemical files from or a PDF document, then append the data, then calculate the physicochemical properties, then export the data to Excel, then do statistical analysis, development and validation of QSR application. So if you have an AI tool, that tool for QSR need to do all these 4 things. Okay? Fortunately, we have so many AI tools available right now. So these are the tools useful for mainly extraction of chemical structures from literature or chemical data from literature, like Designer AI, Biochem Insight, MolMiner, MolScribe, OpenChem. These are Curate GPT, Chemex, Chemexon. Chemexon is actually a comprehensive package. So all these tools they are having the program in such a manner that it can make a decision by taking into consideration several factors. Several factors, just like the artificial neural network. Okay, so several layers of decision making system is integrated into the software so that they can perform reading of the PDF document, recognizing the pictures on that, and then transferring the picture represented like OCR is done, optical reading is done, and that is turned to chemical structures, and from there you can turn the structures into IUPAC names or smile format or InChem format or any other format. So these are the AI tools for chemical data curation. In chemical data curation, what exactly happens is we verify the structure and try to extract data from it. So like physicochemical data, etc. RDKit, DKit, chem data extractor, alpha. These are some of the popular tools. Most popular and comprehensive tool is RDKit. RDKit is a Python program that has to be operated through command prompt only. There is no GUI available. Many GUIs are now available helping people to do all this chemistry work. Okay, they also use RDKit as the key processing element. And don't be surprised if I say ChatGPT can be used for QSR. We are doing a lot of work on this in doing prompt engineering, so that by using appropriate prompts, ChatGPT can help you immensely in doing your chemistry. Perplexity and DeepSeek, most of you are aware of these tools. They are free to some extent, but they are paid versions can help you comprehensively. So let us see one of the examples. As I told you, one of the examples that we worked on RDKit that I will just show you how we have used it. So RDKit is an open source cheminformatics software, open source. So that software is a Python program. So we can integrate it into our requirements because it can do so many things. It can turn a chemical structure into different databases. So here what it can do, it will take the chemical structure and it will turn chemical structure into different names, IUPAC names, SMILES format, INCH format or other formats, and means file conversion. And then it can do calculations so that more than 3 dozen physicochemical properties can be calculated by using RDKit, by using appropriate programs. So what was the workflow that we designed? In the workflow, let us say we have a PDF document, because that is what I told you. We don't want to draw the structures. So here we use a software. This is the Designer AI, Designer.ai. With that, we will read the software, we will read the PDF document and get the structural information, and that structural information is saved in an appropriate format, that is the .mol format or SMILES format or IUPAC names. And then we keep them in a folder so that then we verify the folder, check all the file types, and then if any incompatible files are found, we will filter them. This is how we do the curation in one way. Then load these molecules using RDKit, calculate appropriate physicochemical properties, and export the data to Excel, and then do this, because for one compound this is done, and repeat it for all the compounds so that the data is now into your Excel format. This is one of the most grueling exercises for QSR. Drawing the structures, doing all the calculations so that Excel sheet is prepared. Once you have this ChatGPT chemistry assessment for text mining and prediction of means prediction of synthetic protocols. The article is published in 2022 in Journal of American Chemical Society. The most premium or the ultimate journal for organic chemistry. In that journal, in 2020, this article was published. Okay, this shows the power of ChatGPT or AI tools and prompt engineering. This entire article, if somebody is interested, please note down this and go through the article which is open access. Links, this can supporting document, everything can be downloaded. And this article is absolutely prompt engineering. They use only ChatGPT and given the appropriate prompt so that the ChatGPT got training, and then they used the trained model for their research work. Excellent data. And this is another research recently published. This in 2024. This article was published especially for the teachers, chemistry teachers in the audience. We may go through this data. So here, ChatGPT can help you in preparing assignment sheets and also in the evaluation. ChatGPT helps you immensely. Okay, for example, you are a chemistry teacher and you want to use a small MCQ question bank. And that question bank can be easily generated by using ChatGPT right now. The questions are good standard also. We tried and we tested. Excellent. Okay, so this shows in future every one of the students or research scholars or the faculty need to integrate artificial intelligence and experience in their day-to-day teaching, research, and other tasks. So, with this I will conclude the presentation, and thank you all for your patience.
Thank you, sir. We deeply appreciate the time and efforts.
Hello, can you hear me?
Hello, sir. Can you hear me, sir?
Hello.
Sir, can you hear me, sir? 1 second.
Hello. Hello.
ప్రదీప్ మమ్మల్ని ఎక్కడ
Hello, sir. Hello, sir. It's audible, sir. We deeply appreciate the time and effort you share your expertise and experiences, sir. We deeply appreciate the time and effort you took to share your experience and expertise. Your dedication to advancing pharmaceutical sciences and your exemplary leadership serve as a beacon for researchers and students alike. Thank you, sir. Thank you, sir. Hello, sir.
ఇంకా మామూలుగా వెనకాల స్పీకర్
Thank you, sir. Thank you, sir. It was a wonderful speech.
ఉండరా చూసుకోలేదు.
Now it's time to take a small break. So we are going to have the cultural session. So please join me in welcoming the talented artists as they take up the stage to entertain and inspire us with their vibrant display of tradition and creativity. I now invite Ashrita and Co to perform the cultural performance. For cultural performance, Ashrita and Co. Final performance. 7 నేను రెడీ చేస్తాను.
రిజిస్ట్రేషన్ దగ్గర
ఓకే ఓకే. మీ పర్ఫార్మెన్స్ మీరు చేస్తారా వీళ్ళ తర్వాత? ఓకే. ఇంకా ఇంకెవరు ఉన్నారు? అఖిల మీతో పాటు ఎవరు మీ టీం ఉన్నారా? నెక్స్ట్
ఎవరు రాలేదు పర్ఫార్మెన్స్
వాళ్ళని ఫస్ట్ అసలు కల్చరల్ ఉన్నారు, ఫస్ట్ ప్రెజెంటేషన్ ఇవ్వాలి.
వాళ్ళ అన్నదారు చాలా బాగా నేర్చుకున్నారు. అసలు ఆడియన్స్ ఎక్కడ లేదు కదా.
ఆ అమ్మాయి ఉండకూడదు కల్చరల్లో ఉన్నప్పుడు. వేరే ఇంకెవరికైనా హ్యాండిల్ చేసి రావాలి. అదే నేను కూడా చెప్పేది. మీరు ఇంకెవరికైనా ఇచ్చేయండి. నాన్ పార్టిసిపేట్ ఉంటారు కదా సెషన్లో లేని లేకపోతే సెషన్ అయిపోయింది కదా ఇందులో లేని వాళ్ళు టీచర్స్
లేకపోతే జూనియర్ ఉన్నాను సోలో పర్ఫార్మెన్సెస్
రమ్మని ఫాస్ట్గా సాంగ్ కూడా చెప్పాలి ఇక్కడ. మేము వాళ్ళందరూ సెషన్లో ఉన్నారంట.
చంపేసి మా సోమశేఖర్ కాల్ చేయండి. విలియం సోమశేఖర్ కాల్ చేసి రమ్మని చెప్పి అసలు విలియం నువ్వు ఇంటున్నావా మానుకోలేదు
ఎవరు మా సోలో
ఎవరు ఫస్ట్ సోలో
థర్డ్ బీ ఫామ్ రాగిని రాగిని
చందు
నీకోసం
ఎవరు